Cheryl Martin. Joining me now I have a student of USAT looking to share their experience with you. Meet David Newton.
Hello.
Hi David, how are you?
I'm fine, thanks.
Tell us what made you enter USAT and what your studies are in.
I entered USAT because I think it is very competitive. It provides the opportunity for me to fulfill a lifelong dream, and it allows me to do so in an environment of academic rigor and with an element of care, which I think as caregivers, if we can have that element as an ethic in study and in practice, it augments the overall quality of care that we can give. And it is also uniquely positioned, the university, to allow me to do so within the time factor, the time frame that I'm trying to do it in. And I think it is very dynamic, and I love it. I'm having a good time. I'm doing the MD PhD program, and I was introduced to Dr. Einstein, Dr. Tulp, and all of the wonderful professors here who have been a very great source of inspiration.
Very nice. What field of medicine do you intend to go into?
My background is intensive care, and I would like to carry this on to be an intensivist or an anesthesiologist. I think that all goes well with my experience.
Is there something that led you into this profession?
I think uniquely, I'm from Antigua in the West Indies, and I grew up in a family of 10, and we always had my older brother, who was very, very ill as a young child. Most of the family resources were spent on keeping him alive. And ever since I was a young boy, I've always wanted to dedicate my life to the healing profession. We were very fortunate to meet medical doctors that saved his life on many occasions, and they inspired me. And I always said, I will become a doctor so that, one, prevent illnesses like this, and to be an inspiration to someone else. And I think USAT gives me the opportunity to do that, and I'm enjoying it.
That's beautiful.
Thank you.
How does your family feel about you going in?
My wife is with me. My entire family supports. And this is a lifelong dream, and I've kept it off on the back burner. You know, life happened. I sent my daughter off to medical school. Now she's finished her first 2 years. And this is a 15-year journey for me, and USAT provided the opportunity for me to do so. And I just cannot let it pass by.
So you've launched a daughter?
Yes.
And your wife is also in the program?
Yes.
So you're a medical family?
We aspire to do that.
I'm sure you're going to touch many, many lives. You're going to create a history.
A legacy of healing. And we, not only the healing arts, but in the academic arena of research. And really, this is all happening because USAT, Dr. Tulp, we sat with him and we spoke on many different occasions. And the inspiration, the energy, the vision, it was inevitable that we were going to be here. And we also want to make a positive contribution to not only to our communities, but so that people will know the quality of academic excellence that is here at USAT. And I think that is very important to us, because we want to continue the legacy that they have started. And we're honored to be a part of that.
Yes.
Yeah.
I can feel your passion in that.
Thank you.
I think you've got some great students here.
I would say so.
So now your wife, Shoshana,
Yes.
you're also in the program.
Yes, I'm in the program. We started April, so we're about 4 months in the program. And so far, I see it is remarkable. Like David mentioned, just the quality of the professors, they're top notch. Like, these are retired physicians, some are still practicing, and just the body of knowledge that they have to impart, it's just amazing. And Dr. Tulp here, he's a whole body of knowledge. I could ask him any topic, and he knows it. He just rattles it off like it's, like he's written a book on it or something.
Right.
And this is an opportunity where I can actually live my dream. I've always wanted to be a doctor, and as a kid, I've seen my grandmother who struggled through many illnesses, and I told myself I will be a doctor because I can actually change lives, and I wish I was able to change her life. She's passed now. But I know that by going in this area, I can change so many lives on so many levels. And I'm also a nurse, and I've seen, excuse me, how doctors and nurses have been, operating when it comes to patients' lives and communication. Sometimes it breaks down, but I can see where we can actually build that bridge between doctors and nurses, and maintain that respect that is supposed to be there, and continue to change lives for the positive.
I know what you're talking about, where nurses don't get the respect that they need, and sometimes doctors, their ego can kick in sometimes,
Yes.
and a nurse has the correct diagnosis, the doctor doesn't want the correction. I don't know that that's going to change, but I can see that you have the passion to bring it there.
Yes.
Having the experience as a nurse versus opens your heart to something completely different.
Definitely.
Dr. Tulp,
Yes,
you have chosen some fabulous students to be in your program,
we sure do.
and they look up to you highly, I can see. What's your passion in teaching?
My mother was a school teacher, and she always taught me the value of education. She never told me I was supposed to leave school. And so here I am a few years later. But I'll always remember when I finished my PhD, and I'll never forget the moment when I graduated with my doctorate, my first doctorate. They drove 400 miles in their Volkswagen to Vermont to see this, because I'm the youngest son in my family, and I have 4 older brothers surviving, and I'm the youngest in the family, the first one to graduate from college, and the first one to earn a doctorate. And she was so proud of that. She carried my thesis around with her forever and made sure that no one would pass that didn't know that I was a doctor, that
That's
her son was a
beautiful.
doctor.
Oh, I love
But
that.
I love to teach, and I love the passion. You can touch so many lives teaching, and that's the obligation of a physician, to teach and touch lives and do what you can for the betterment of society. I've done lots of this kind of work. I've done over 250 humanitarian medical missions in my career, and I would probably do another 250 if they'd let me.
I love that.
But they were the most rewarding missions I can ever have had, and I'm very fortunate to have had the opportunity to have done that.
What made you choose to go into medical fields?
I just always wanted to be a doctor, I think. I didn't go through the usual things like many kids do. I grew up in the country, and many kids want to be a fireman or a policeman or something like that, and I was always much more interested in something more scientific. And I was the only one in my family that went in this direction, since Dr. Nicholas Tulp, who was painted by Rembrandt, and there's quite a gap there between and he was fortunate, because one of my ancestors, in my ancestry here, Dr. Nicholas Tulp, is the subject of the painting Dr. Tulp and the Anatomy Lesson of Dr. Tulp by Rembrandt. And he was the one who discovered beriberi and hyperlipidemia in man, the first one to publish. And so when I discovered that, I kind of felt obligated to keep the standard, keep the standard up and continue with that. I've been a research scientist most of my career, and I was previously at Drexel and the University of Vermont and a few other places. But I've lectured and I've taught probably much all over the world, and had lots of time abroad. I've learned a lot about how medical education works in other countries, and that's important because you have to have a more global perspective these days, and you have to know more about some of the illnesses that affect other parts of the world.
Absolutely.
Especially now with air travel and communications and transportation being on a global level much more so than when I was a lad. People can jump on the airplane and be halfway around the world in a few hours and take the illnesses with them. And that happens every single day.
Right.
Oh.
Can you share with us one of your favorite missions?
It would have been up on the Altiplano in South America. It's very special.
We've got you choked up.
Yeah, it does. It does indeed. Yeah.
That shows what a wonderful and amazing man you are.
No, we were up at the Altiplano at about 10,000 feet above sea level, and we had a huge clinic set up where there were no doctors, and people would come from miles around to visit our clinic. And now we've got to be physicians to treat not only the local illnesses that we're accustomed to back here, but tropical diseases that we've never seen before sometimes. The very first patient that I saw had leishmaniasis. And I knew about it. I'd never actually seen a live case. And we saw about 20 patients with that. We've seen patients with many different things. We think about some of the diseases that the World Health Organization tells us are extinct now. If you go into the jungle, they're not necessarily extinct. They still occur. And we saw them oftentimes. We saw things that we wouldn't have seen here at all. And you have a much greater appreciation for how medical care is delivered in other parts of the world.
I'm sure it must also teach you
It does.
to think beyond the
You have
obvious.
to think outside the box.
Yeah.
You truly do. You have to recognize that what we accept as standard here may not be the same there. So you will see everything from malaria to parasitic disorders of all sorts to injuries that here we'd have an emergency room to treat and restore, and there, not so much. The patients are the most appreciative I've ever seen in my life. I had one lady that I remember. She was 19 years old, and she came to me. She had no shoes. She had never owned shoes, and she had 5 children, 19 years of age, and she had pellagra from nutrient deficiency, B-complex deficiency. And so the treatment for us was easy. We'd give her a multivitamin, and that would actually bring about a cure for that illness, that disorder. And then we treated her for intestinal parasites, which were linked to her deficiency.
Right.
Parasites get there first, and they eat well.
Yes.
And so we treated lots of people for things. We thought tuberculosis, like at one town that we were in, we set up in a small school by a river, and every patient that we had for the first couple of days had some form of tuberculosis. And so before the end of the mission, we were the one who were masked instead of the patient. But fortunately, we were able to protect ourselves and still treat the patients. We probably saw 100 patients with tuberculosis, more than most physicians see in a career,
Right.
in 2 days. So those missions were so important.
I can
You
see they're
really
important to your
appreciate them.
heart as well.
Yeah,
Do you recommend that your students participate?
I surely do. I think I would like to see every student do an international rotation. We just had one come back from 6 months in Peru. And there he was able to, in the US system, he would only be an observer, but there he was able to deliver babies, to be the first assistant in surgeries, in some cases to do the surgeries, to do things that were within his scope of his training to the best of his ability to do so. He had an extraordinary experience. I had another student that was did 3 months in Senegal. Again, she's the first assistant in surgery, when she schedules, they schedule her for a series of patients every morning in the clinic, just like everyone else. It was just such an extraordinary experience for them to have this, and it teaches them one thing that is difficult to teach in a Western setting, and that is they have to think on their feet from the day they wake up in the morning, from the time they wake up and report to the clinic, until they leave. They will do amazing things. Every student should have the opportunity, and we try to create that opportunity to go to another country, another environment. I spent a number of years in the UK myself. Their medical system is different from ours. We use the same drugs, the same medications, the same surgical procedures, but how you deliver them is a little different.
Right.
And so it's really instructive to have that breadth of experience to do that.
And so your educational programs offer opportunities? You have
Absolutely.
the connections?
Absolutely. I would love every student to be able to do that, to do a missionary trip, to do something. We just had one last year, went to, the South Pacific, where they'd had, the Philippines, where they'd had hurricanes and typhoons or something, serious weather issues. And they went in and did all kinds of medical treatments to people where there is no doctor, where there's no alternative. It really makes you think on your feet. And you don't always have the drug of choice, but if you can think on your feet, you'll come up with a solution to resolve that. And sometimes you just they need someone to talk to. But the one thing that you do see when you go on these international missions, they're not going to come to your clinic for a runny nose,
Right.
for a minor illness. They will come to your clinic when they're really sick. There was one that I remember still. I can picture her as I look at you right now. She was 11 years old. She was an Indian up on the Altiplano. And when she came to see me, I recognized that she had all the symptoms of meningitis. And she probably had 48 hours to live if we didn't do something. Now, we don't have hospital privileges because we're out in the bush. We treated her the best way we could. We all put we passed my hat around. We all put $10 in the hat. And within a minute or two, we had $300 in our kitty. We contacted a local physician who could now take her to the nearest hospital, admit her, and then treat her. We provided the medications to treat her. 1 week later, when we came back to visit her, she was just being discharged from the hospital. Now, in the Bolivian system, she would have been not so fortunate, because she'd gone the extent of what they could do. In our system, we would not allow that to happen.
Right. How many lives do you think you've touched?
Couple.
I think you're at more than a couple. You're in a couple just in this room.
Yeah. Yeah, you touch so many lives that you don't even realize it, and those lives touch others. And it's kind of like a cascade.
On that point, I want to interrupt you for a second. This is a lovely conversation. I apologize for interrupting. I think we need to segment it. And so what I'm thinking is we need to have you close this one and do another interview with the next segment.
Okay.
This is getting independent in thoughts.
All right, but I love that he's really passionate about what he's talking about, and I don't think his students see this side of him, and I think that will be really encouraging to his students. I think it's really beautiful. I'm glad we don't have to pursue it any further, but I just think, for yourself, I think that's just,
Yeah.
you've touched me and I'm not even your student. So, thank you for sharing your experience with us. I'm Cheryl Martin. Thank you for joining us. Until our next time, be well.